It is 4:30 in the afternoon. The air conditioning has been running all day. Your dog hasn't been outside since his morning walk. He hasn't been playing, he hasn't been chasing anything around the house. He is just lying there on the cool tile floor. And he is panting. Not the kind of panting you see after a game of fetch, not the big, sloppy, happy panting of a dog who just sprinted across the yard. This is different. This is quiet, steady, relentless. You look at him and something in your gut says this isn't right. But then you think, maybe he's just warm. Maybe he drank too fast. Maybe he's just being dramatic. And you go back to whatever you were doing. My friends, I need you to hear this. That moment of hesitation, that maybe it's nothing, is the exact moment where so many loving, attentive pet parents unknowingly miss a warning that their dog has been trying to send them for weeks. Dogs cannot say, I'm in pain. They cannot say, something inside my body is wrong. The only tool they have is their behavior. And panting, specifically indoor panting at rest without an obvious reason, is one of the most misread signals in all of veterinary medicine. What if I told you that there are 5 distinct types of abnormal panting, each one with its own unique cause, its own set of visual clues, and its own correct response, and that once you know how to tell them apart, you will never look at your dog the same way again? Hi everyone, I'm Dr. Nathan Reed, your neighborhood veterinarian. I've been practicing for over 2 decades, and I split my time between traditional clinical medicine and holistic integrative care. And I can tell you with complete confidence that abnormal panting is one of the top 3 reasons dogs come into my clinic for emergency visits every single year. Today we are doing a complete masterclass on what your dog's breathing is actually telling you. We're going to cover the biology of panting, how to tell a healthy pant from a dangerous one, and then we're going to walk through all 5 warning types, including, at the very end, the one that looks the most normal, but that I have personally seen precede serious medical emergencies more times than I can count. That 5th type is the one I really need you to stay for. Grab a notebook. Let's start at the very beginning. To understand when panting is wrong, you first have to understand exactly what it is supposed to do. Dogs do not sweat through their skin the way humans do. They have a tiny number of sweat glands, located only in the soft pads of their paws. That is it. So when a dog's core body temperature rises, their primary cooling system is their mouth. When a dog pants, they pull outside air rapidly across the wet surface of their tongue and the lining of their throat. That moisture evaporates, and that evaporation pulls heat directly out of their body. It is a beautifully efficient system. Think of it like a living, breathing radiator. The tongue is the cooling fin, and the rapid airflow is the fan. Normal, healthy panting has a very specific look. The dog's mouth is wide open, the tongue is flat, relaxed, and hanging loosely to one side. The rest of the body is relaxed. Their eyes are soft. Their breathing, while fast, has a rhythm to it. Here's what I call the healthy panting checklist. 1. There is a clear reason for it. Exercise, heat, excitement. 2. It stops within 5 to 10 minutes once the trigger is removed. 3. The dog's body posture is loose and relaxed. 4. They are willing to drink water, lie down, and settle. Now, if your dog is panting indoors in a cool environment without any recent physical exertion, and that panting does not stop on its own within a few minutes, that is when we need to start paying very close attention. Let me walk you through the framework I teach every single pet parent who comes through my clinic. I call it the Pant Pattern Check. Every time you see your dog panting unexpectedly, I want you to ask yourself 3 questions. First, is there a cause I can see? Second, how long has this been happening? Third, what does the rest of their body look like right now? Those 3 questions are going to be your guide through every single type of panting we discuss today. Hold on to them. Let's start with the first warning type. The first type of abnormal indoor panting that I see overlooked constantly is pain panting. And the reason it gets missed is surprisingly simple. When we think of a dog in pain, we picture whimpering, limping, crying out. We picture obvious distress. But chronic pain, the kind that builds slowly over weeks and months, almost never looks dramatic. It looks like a slightly restless dog. A dog who shifts positions more often than usual. A dog who hesitates before lying down or getting up. And yes, a dog who pants quietly and steadily for no apparent reason. Here's the biology. When a dog experiences ongoing pain, whether it is arthritic joints, a spinal disc pressing on a nerve, or internal abdominal inflammation, their nervous system stays in a low-level state of alarm. Their sympathetic nervous system, the fight-or-flight system, runs at a slightly elevated baseline. And one of the direct physiological outputs of a chronically activated sympathetic nervous system is increased respiratory rate. Panting. I had a patient, a 9-year-old golden retriever named Charlie. His owner, a woman named Patricia, brought him in because he had been panting every evening for about 3 weeks. No fever, no obvious injury. He was eating fine. She assumed it was just an old dog thing. When I did a full physical exam and ran some imaging, We found significant arthritis in his lower spine and both hips. Charlie wasn't having a bad night here and there. He was in persistent, quiet, grinding pain every single day, and panting was the only way his body knew how to express it. If you suspect pain panting, here's what I want you to do at home before anything else. Watch your dog transition between positions. Getting up from lying down, sitting, climbing stairs, pain dogs hesitate. They shift their weight. They are careful in a way that looks stiff. Now for holistic support at home, two of my absolute favorites are pure ground turmeric mixed with a tiny bit of coconut oil, stirred into their food, and sardines packed in water with no added salt given twice a week. Turmeric contains curcumin, which is one of the most clinically studied natural anti-inflammatories in veterinary medicine, and the omega-3 fatty acids in sardines act like a fire extinguisher for inflamed joint tissue. I have watched dogs go from reluctant to rise to genuinely playful within 3 weeks of consistent omega-3 supplementation. But please hear this, if the panting is new, persistent, and your dog is 7 years old or older, do not rely solely on kitchen remedies. Book a physical exam. Pain caught early is pain managed effectively. Pain ignored becomes a much harder conversation. Now, what if the panting has absolutely nothing to do with physical pain? What if it is coming from somewhere much deeper, from inside the hormonal system itself? This brings us to the second warning type, and this one surprises most pet parents completely. Hormonal panting is real, it is common, and it is chronically underdiagnosed in older dogs. The most frequent culprit is a condition called hyperadrenocorticism, but you will know it by its common name, Cushing's disease. Here's what happens. The adrenal glands, which sit right on top of the kidneys, produce a hormone called cortisol. Cortisol is the stress and inflammation regulator. In a healthy dog, cortisol is released in precise, controlled amounts. But in a dog with Cushing's, a benign tumor, usually on the pituitary gland, sends a constant signal telling those adrenal glands to keep producing cortisol nonstop. The dog's body is essentially stuck in a permanent low-grade stress response. And one of the most consistent symptoms? Chronic panting, especially indoors when the temperature is comfortable. The 3 companion signals that I always tell pet parents to watch for alongside the panting are these. First, a belly that seems to be gradually getting rounder and lower, almost like a pot belly forming over several months. Second, a noticeably increased thirst. The dog is drinking much more water than usual and asking to go outside to urinate more frequently. Third, a coat that is thinning, especially over the dog's sides and belly, sometimes revealing darker pigmentation on the skin underneath. If your dog is between 7 and 12 years old, pants persistently, and has any 2 of those 3 companion signals, please call your veterinarian this week. Cushing's is very manageable when caught early. The diagnosis is a simple blood panel. Ignoring it causes internal organ damage that cannot be undone. Now, let's move to the third warning type. This is where things become urgent. Toxic and fever panting is the category where minutes matter. When a dog ingests something poisonous, or when their body temperature rises above 103 degrees Fahrenheit due to illness or infection, their physiology changes rapidly. The panting becomes much more labored. The mouth may be open wider than normal. The gums, if you gently lift the lip and look, may appear pale, white, yellowish, or in the case of high fever, a deep, angry brick red instead of their normal, healthy bubblegum pink. I want to take a moment here and be extremely direct with you about one specific toxin, because it is everywhere and it is deadly. Xylitol. You may also see it listed on product labels as birch sugar. It is an artificial sweetener used in hundreds of human food products. Sugar-free peanut butter, certain yogurts, protein bars, some flavored waters, chewing gum. Even a very small amount of xylitol causes a catastrophic drop in a dog's blood sugar and can trigger acute liver failure within hours. If you ever share food with your dog, read every label, every single one. The ingredient you are looking for is xylitol or birch sugar. I want that word burned into your memory. Here is how you identify toxic or fever panting. Apply your Pant Pattern Check. Is there a cause? Yes, a potential exposure to something dangerous or signs of illness like lethargy and loss of appetite. How long has it been happening? It is escalating rather than resolving. What does the rest of the body look like? Gums are off color. The dog looks uncomfortable, hunched, or disoriented. Do not wait and see. If you have any reason to suspect your dog was exposed to a toxin, call your veterinarian or the ASPCA Animal Poison Control Center immediately. Do not wait for the panting to get worse. Now we arrive at the fourth type. And I want to pause here because this one tends to generate pushback when I bring it up. People hear anxiety and they think, oh, my dog is just nervous sometimes. That's not a real medical issue. My friends, I need to respectfully correct that assumption with science. Anxiety panting in dogs is not about the occasional thunderstorm or the trip to the vet. I am talking about dogs who live in a state of chronic, low-level anxiety Where their cortisol baseline never fully returns to normal between stressful events, their nervous system essentially forgets what it feels like to be completely calm. The physical consequences of this are not minor. Chronically elevated cortisol suppresses the immune system, damages gut lining, accelerates cellular aging, and yes, produces persistent panting because the sympathetic nervous system never fully powers down. How do you recognize anxiety panting? It tends to cluster around specific triggers that you might not even think of as stressful. Your schedule changing, a house guest visiting, loud noises outside, but the pattern is cyclical rather than constant, and the dog's body posture gives it away. Watch for yawning that seems out of context, lip licking when there is no food present, pacing, an inability to settle even in a safe, familiar environment. For holistic support, one of my absolute favorite calming tools is a frozen lick mat. Take a silicone lick mat, spread a mixture of plain unsweetened yogurt, mashed banana, and a little unsalted peanut butter across the surface. And before you do, check every label carefully for xylitol or birch sugar because some brands of peanut butter and flavored yogurts use it and freeze it solid overnight. The repetitive act of licking releases a steady stream of endorphins and dopamine directly into the dog's brain, naturally lowering cortisol. I also recommend brewing a weak cup of pure chamomile tea, decaffeinated, cooled completely to room temperature, and pouring 2 or 3 tablespoons over their dinner. Chamomile contains apigenin, a compound that binds to the brain's GABA receptors, the exact same receptors targeted by anti-anxiety medication, and promotes gentle, natural calm. One more tool, brown noise, not white noise. Brown noise is a deeper, lower frequency of sound that biologically masks the mid and low frequency sounds that trigger a dog's alert system. Play it softly in the background during the hours your dog tends to be most restless, and watch their breathing slow down. For dogs with moderate to severe chronic anxiety, please work with your veterinarian. There are excellent modern options that can reset that cortisol baseline without sedating the dog. Natural tools are powerful, but they have a ceiling. And now, we have arrived at the 5th type. The one I promised you at the beginning. The one that looks the most normal. The one I consider the most dangerous precisely because of how innocent it appears. I call it the silent labor pant. And it happens when a dog's cardiovascular or respiratory system is beginning to compensate for a developing problem. Most commonly, early-stage heart disease, fluid accumulating around the lungs, laryngeal paralysis, or the early stages of an enlarged heart. Here's why it is so deceptive. The dog does not look dramatically sick. They are not collapsed. They are not crying. They are often still eating, still greeting you at the door, still wagging their tail. But they are panting, persistently, quietly, even during sleep. And the panting is gradually, almost imperceptibly, getting a little worse each week. The key identifiers I want you to memorize are these. The pant is shallow rather than deep and open-mouthed. The dog's elbows may be slightly angled outward when they stand, as though they are bracing their chest to open up their airways. They may be less enthusiastic about exercise than they used to be, not dramatically so, just slightly less willing to walk the whole route. And sometimes, only sometimes, you will notice a very subtle cough, most often right after waking up or right after drinking water. I had a patient, a 7-year-old Cavalier King Charles Spaniel named Rosie. Her owner, a man named David, brought her in for what he described as just a weird breathing thing. She had been a little pantier than usual for maybe 6 weeks. He almost didn't come in because she seemed otherwise completely fine. When I put my stethoscope on Rosie's chest, I heard a significant heart murmur. Her chest x-ray showed early cardiac enlargement. She was put on medication that day. David told me afterward that if he had waited another few months, the disease would have progressed to a point where our management options would. That is why this 5th type matters so much. The window for intervention is open right now, but it does not stay open forever. If your dog is panting in a way you cannot fully explain and none of the other 4 types seem to fit, please do not self-diagnose this one. Book a physical exam and ask your vet specifically to listen to their heart and assess their respiratory function. It is a 5-minute part of a checkup. It could be the most important 5 minutes of your dog's life. My friends, let's take a step back and look at what we built today. We started with a dog lying on the cool tile floor, panting for no obvious reason. And now look at what you know. You know that pain panting hides behind stillness and subtle stiffness, and you know to look for hesitation and movement. You know that hormonal panting whispers through a growing belly, thinning coat, and unquenchable thirst. You know that toxic and fever panting is the one where every minute counts. And you know to check those gums and scan every ingredient label for xylitol or birch sugar. You know that anxiety, panting is not just nerves, but a real physiological state with real long-term consequences. And you have practical, holistic tools to address it tonight. And you know about the silent labor pant. the deceptive, gentle, persistent breathing pattern that is sometimes the first and only warning your dog's body gives you before something serious takes root. You have the Pant Pattern Check. Is there a visible cause? How long has it been going on? What does the rest of the body tell you? Here is my challenge to you tonight. Just tonight, I want you to watch your dog breathe for 60 seconds while they are at rest. Just 60 seconds. Observe the rhythm. Count the breaths if you can. A healthy resting dog takes between 15 and 30 breaths per minute. If you are counting significantly more than that consistently, that is your Pant Pattern Check telling you to pay closer attention. You don't have to do everything we talked about today all at once. Pick one thing. Maybe it is reading the label on your peanut butter jar tonight. Maybe it is making a frozen lick mat this weekend. Maybe it is calling your vet to schedule that checkup you've been putting off. Every single one of those small actions is an act of love. If this video gave you clarity, if it helped you see your dog a little differently, please do me a favor and hit that like button right now. It tells the algorithm that this kind of honest, practical veterinary information is worth sharing, and it helps us reach more pet parents who need it. Subscribe to the channel so you never miss our deep dives into natural dog health. And please, leave me a comment below. I want to know, is your dog a chronic panter, or did you just notice this recently for the first time? Tell me what type resonated with you most and what you are going to do about it tonight. I read every comment, and I genuinely love hearing from this community.